Greetings to you all. So today I'm planning to take a lesson on listening part A, because many students requested me to put up a lesson for part A to understand what can be done when we're doing in listening. There are many mistakes which candidates do more often so that they miss on answers. Now there are we on this lecture, in this video, what we'll be discussing is we'll be discussing what can you do when you're listening live a part A audio, what kind of techniques you need to follow, how you should keep a track of your signpost words, how you should keep a track of your keywords. These all things we'll be focusing on today. So I'll be sharing a live presentation which will help you to understand what is OET listening first. Now, once you understand what is OET listening, then I'll be able to explain you how to start with part A, B, or C. So I'll just share it on the screen. I believe everyone can see this. Okay. Now, let's understand this very clear about the listening part. Is this listening part test is divided into three parts. That is part A, part B, and part C. Now, in part A listening, what happens is they are trying to understand how well you can capture details, because this would be a communication between a healthcare professional and a patient. So you will, most of the time you will listen, two speakers would be speaking about the condition, and maximum amount of speaking would be done by the patient, not by the healthcare professional. Healthcare professional would be asking questions related to his problem, related to his diagnosis, whatever kind of problems he has faced. So here you will get to listen about the background of the patient, like medical history. Patient would be telling about what kind of treatment he has gone through yet, what kind of treatment he has been taking now. These kind of informations you would be able to listen. So this is completely a gap filling session. So I'll just cover that ahead. So today in this lesson, we will also be doing a live listening test, which will really give you an idea how to do it. So I'll also help you to find answers. So this was going to be an interactive session where you will learn live with me. You can keep a pen and paper ready with you. So once I play the live test, you can also write down answers, which will really give you just like how to perform this listening part A. Then comes the part B. In part B, they try to find like how well you're able to understand the gist, purpose, detail, and function. The same way in part C, which will be a two lengthy audios, you will be listening. It could be a medical lecture, or it would be a discussion, or it can be one way or two way, two people talking at the same time. So part C will also cover topics such as gist, attitude, and opinion. They will be looking like, are you able to understand the gist of the entire communication? Are you able to note down the opinion and then accordingly choose which is the right option for you? Now, listening task is divided into three parts. That is part A, part B, and part C. Now, in part A, which is a gap filling session, in this, you're going to get two extracts, which means two audios. Okay, there will be four speakers in total, which means in each extract, two people would be speaking at a time. Okay, two people would be speaking at a time. So it would be a communication between a healthcare worker and a patient. Okay, so this is something you should understand. You should understand very well. There'll be four speakers in total. Okay, now in this two extracts, out of these two extracts, you will get 24 questions altogether, which will be fill in the blanks. 24 questions altogether, which will be fill in the blanks. So each extract will have 12 questions. Altogether, 12 questions. Okay. So each audio, whichever you're listening, each audio will have 12 questions, which would be gap filling. So you need to pay attention to this, that you make sure that each word which is given to you over there, you should be able to fill it appropriately, okay, which is very much required. So you should keep in your mind about the keywords. Like they give you initially a time of around 1 or 2 minutes. They give you to look at the questions. So initially they give you 30 seconds to look at one extract, but before that, they would be discussing about the initial part, what is the scenario, what is the situation, those kind of things would be briefed to you. Okay, so you need to make sure in that time, utilize that time to look at all the 12 questions. You need to understand the topic very well. If you understand the topic very well, and if you just underline the signpost language, the signpost word, not language, the word which is given to you, that will direct you what kind of information would be there in part A and what kind of information you can predict, because certain answers in part A you can literally predict, which will help you to understand when the audio has been played. You'll be able to solve and find out the right answers appropriately. So part A is all about 2 extracts. Part B would be MCQs, which will be 6 short extracts. For each MCQ question, you will get one dedicated audio, which makes it very easy for you. So there will be approximately 12 speakers, which means in each audio, there will be 2 speakers who would be communicating with each other. So it can be a discussion, it can be a handover, it can be anything. So part B is all about 6 multiple choice questions, which will have 6 dedicated audio. Then you have part C. Part C has got 2 longer extracts. 2 longer extracts as in there'll be 2 medical lectures, or one can be a medical discussion, but it will be a lengthy one. Okay, and each part, each audio, each extract will have approximate 6 multiple choice questions. So total you would have 12 multiple choice question in part C, 6 multiple choice question in part B, and 24 questions in part E. So altogether in listening, you will have 42 questions. In 42, you need to get minimum 30 answers correct. That is what the requirement of your listening task would be. Now, when you're doing listening part A, make sure you write as you listen. Don't change anything. Don't change anything from what you listen. Make sure you write the same topic as it is. Don't change anything. And answers, it's better to write as short as possible. Make sure, see now in your part A, minor spelling errors are completely acceptable. Grammar mistakes are also okay. But make sure, like try to avoid it as much as possible. But even if you make some minor spelling errors, completely fine. Okay. Now, when you're writing one answer, because most of the time what happens with candidates is they feel it very difficult to follow the pace of the audio. Make sure when you're writing down the answers, keep a note of the words which is surrounding that answer. That will carry a link to the remaining communication, which we'll see in live lesson, which we will be doing it right now, which will make it very simple for you. So make sure write as short as possible, avoid maximum spelling errors, and make sure, like even if you make any spelling errors, it's completely fine, but make sure have a habit of listening to multiple audios. There are some live streaming web series going on. There are some live streaming series about medicine. Like for example, in UK, the most famous one is 24 hours in A&E, that is accident and emergency, which interviews patients. So listening to their communication, listening to the condition, what they're describing, what kind of experience they had, you're really improving your skill to comprehend such kind of listening part. Okay. Now, in part A listening, the word or phrase that you use to fill the gap can be one, two, or few words or a number, but not more than 3 words. Maximum it is like I have seen most of the answers, 99% of the time, the answers are 3 words, not more than that. Pay attention to signpost words. Signpost words are those words which guides you what the communication is going to be. The first signpost can be background, second signpost can be about the treatment, fourth signpost can be about the medicine. So you need to make sure you pay attention to these signpost words, which will help you to understand what it is and what to be done in that. Okay, so now after understanding this, we'll be doing a live listening test, which will be like I'll be playing the audio from my side. I will be displaying the questions in front of you, which will give you a clear idea how to do such kind of tests. And then if you really like this lesson, these kind of lessons, you want to see more, you want to attend it on our page, make sure you like our page. Make sure you share this video with others, share our page with others. If we see maximum participation, if we see maximum people who are coming in and really enjoying these kind of lessons, we can come up with this kind of lessons and we can really help you with these lessons. Okay. So now I want everyone, I'll give you 1 minute, everyone, to take your pen and paper. So pen and paper, so that the test, we are going to do it live. And at the end, whatever answers, how many answers you write, those answers you can post it in the comment box. You can take a picture and post it. I'll correct it and give it to you, or you can correct it. I'll post the listening answers in the comment box itself. You can check it and then you can cover your part in this. Okay. Now I'll give you 1 minute. Everyone, you can go and carry your pen and paper, and then we can start. Okay. So I'll begin from there. Thank you. I'll just hold on for 1 minute. Now let's do it live. I'll just show you the question paper, which we are going to do. I believe you guys can hear it very clear. I'll just check, just hold on for a minute. Okay, so I believe everyone is on the mobile phone. People who are using your laptops, you can zoom out if you're not able to look at the questions. Please make sure, please understand that this is how we will be doing our part A. Now, I believe everyone can see the questions very clearly. Okay, these are the 12 questions which we would be solving. I'm trying to arrange it on the screen. You can definitely zoom your screen to see it, like how it works, and you can see the answers as well. Things would be really easy for you. I'll also be trying to solve the answers with you. I'll try to solve the answers with you so that you're very confident. See, now initially in part A, what you hear is you get to know about things such as, like, see, now these kind of sentences you would see in the beginning, they would speak about that you hear a consultant rheumatologist talking to a patient called Suzanne Hines. For questions 1 to 12, complete the notes with a word or short phrase. And then you would give you 30 seconds to look at the notes. So you should make sure that utilize this 30 seconds first to look at the left hand side. Those are your kind of signpost words. First, they're going to speak about symptoms. Then the signpost words are mouth, eyes, throat. So this communication is going to be about the symptoms what patient is suffering from. First, they're going to discuss about mouth. Second, they're going to discuss about the eyes, some kind of symptoms what they are uh, feeling or the patient is feeling related to the eyes. Symptoms patient is feeling related to the throat. Then we are going to speak about the background details, and then we are going to speak about the recommended test. Okay, so this is how we are going to do our test. So what I want you to do is, I'll be playing the audio from my side. I'm pretty sure you'll be able to listen to the audio very clear. So as the audio plays, try to solve these answers. The first one, I'll help you to find answers. So I'll also do with you. I'll type answers over here so that you're very clear with the answers. The first one, you'll do it with the help of me. I'll type answers over here. The second one, which we'll be doing, that you'll be doing it by your own. And then you'll upload your score. People who are watching, people who are participating will upload your score in the comment section. Once we are done with it, I'll post the answer sheet, the screenshot of the answer sheet in the comment box so that you can check your answers and then particularly upload your score. So we get to know how we are learning things. Even I'll get to know that whether these kind of lessons are helping students to learn. This is our aim, like to provide candidates the kind of lessons which they really require in terms of their preparation. That is what our aim is all about. So I believe this will really be helpful for you. At the end, I expect all of you to comment in the comment box section so that we know that you are benefited from this. Okay, so now let's begin. I'll just play the audio first, then again I'll come back to the share of the question paper. Just hold on for a minute. I'll just play the audio first, then I'll come back to the share. Just hold on. Everyone to be ready with your pen and paper. Then we would begin. Okay, here we go. So I'll play the audio now. Here we go.
Occupational English test. Online course practice test 1. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a consultant rheumatologist talking to a patient called Suzanne Hines. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Okay, now utilize this 30 seconds to look at the notes carefully. First, look at the left-hand side where you know symptoms, background, recommend test. Then look at the signpost language and try to predict. Mouth, what can be painful? Increased numbers of what? In related to mouth, it can be dental caries. Tongue appears red, ulcerated, cracked. It can be anything. Try to predict answers. Try to look at all these signpost words in 30 seconds. You should not take more than that. You can divide it into 4-4.
Afternoon, Mrs. Hines. Now, you've been referred to me by your GP.
That's right.
Okay, so I've got some notes here with his referral letter, but it'd be helpful if you could tell me in your own words about the problems you've been having.
Well, I've been having various symptoms recently. Apart from generally feeling tired, I've started noticing how chapped my lips were. I'm always using lip salve. Then, on top of that, I began getting quite a few mouth ulcers, and they're really sore. Oh, and something else. I've always gone regularly to the dentist and, well, I used to have the odd filling, but now she keeps finding dental cavities, so I'm always having them done.
I see. And does your mouth feel dry?
Yes. I'm always sipping water to try and help, but it doesn't really, and my tongue started hurting. I noticed in the mirror it looks, well, cracked is the way I'd try to describe it. My whole mouth feels different.
And you've had some eye problems too, I gather.
Yeah, they feel dry too. But then some mornings when I wake up, my eyelids themselves feel, well, sticky. The skin area around my eyes itchy too, and I end up rubbing it. I mean, it's particularly bad when I'm somewhere with air conditioning, like at work.
And have any over-the-counter treatments helped?
Well, I don't fancy putting ointment round my eye, but I do use eye drops, which help, though the effect soon does wear off. I wonder if the drops are causing other problems, like I keep on getting conjunctivitis, and people mention how tired I look. It's so embarrassing.
And what about your vision? Is that affected?
Well, I must say strong sunlight really does bother me now. I use sunglasses a lot more than I did, and, well, yeah, thinking about it, things do look, well, cloudy occasionally, and that worries me a bit, actually.
Yeah, it must do. Is there anything else you've noticed? What about your throat?
Well, it's not really sore as such, but from time to time it feels what I call rough. And when I eat, I've always got to have a drink to hand. It can be hard getting stuff down otherwise, to be honest. I've never used to have any problems swallowing food, but I do tend to panic now if I haven't got something to drink while I eat. I don't know if I'm imagining it too, but I could swear my throat's a bit swollen. It's hard to remember how it was before.
And is this affecting your job? Is it making things harder at work?
Tell me about it. My voice is often strained anyhow, as, well, I'm a tour guide, so talking most of the day. But everything's making that worse, and I often struggle to be heard. And, well, lunchtimes are always rushed anyhow, but now it's taking me longer to eat, and I've got less time than ever. I do wonder if all my years as a smoker are returning to haunt me. I mean, though I smoked about 10 a day for about 15 years, it's a good 12 years since I gave up.
Oh, well, that can only be doing you good. And what about your family? Do you know of anyone having similar symptoms to yours?
No, not that I know of. My dad always smoked and he didn't have any lung problems as I recall. My gran and aunt suffered from rheumatoid arthritis, though. Well, I do remember that. I don't think I've got that, though. My symptoms are completely different.
Well, no, but we do need to check possible links. For example, an autoimmune problem. We'll start by checking your saliva production with what's called a saliva flow rate test.
Okay, that sounds straightforward.
Yes, it's pretty self-explanatory. But I'm also going to recommend a biopsy of your lip, the lower one.
Oh, that sounds odd. What for exactly?
Well, it'll let us see the salivary gland tissue. Don't worry, you won't feel anything. It's done under local anaesthetic. And you've not had a thyroid function test, so I might recommend that you have one of those, depending on the earlier test results.
Okay, fine. Well, anything that sorts out this problem.
Okay. I believe that was pretty easy. Okay, it was not difficult at all. You were able to find answers. See, I tried to help you with answers. Make sure you're on full screen and you're able to see it, what I have typed it. So I've typed the correct answers. So I did a listening test with you. So this is the part A, first part. Now we'll be doing the second part of part A, the second extract. This you would be doing it by your own. I'll play the audio from my side and I'll make sure that you're able to get answers. The same technique. Initially, they're going to describe, you hear a gastroenterologist talking to a patient called Toby Smithers. For question 34, these all information they're going to give. Meanwhile, just understand what is the patient's name, understand the signpost word, and then try to read it quick. You can divide it into 4 questions for 10 seconds because they're going to give you 30 seconds. So you read first 4 questions in 10 seconds, the next 4 in another 10, and the next 4 in another 10. So you're able to divide the time appropriately. This will definitely help you. So I'll play the audio from my side, the second audio, and then I'll display the questions back to you so that you can solve it now. So here we go. I'll play the audio.
Extract 2. Questions 13 to 24. You hear a gastroenterologist talking to a patient called Toby Smithers. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
So now utilize this time to look at the questions.
Mr. Smithers?
That's right, Toby Smithers.
Now, I think you've been having some stomach problems.
Yes, that's right. For some time, actually.
Okay, I've got some notes here, but perhaps you can tell me in your own words about those problems. About any treatment you've been having, or anything else you can remember that seems relevant.
Okay. It all started about 9 months ago with a stomach upset.
Okay.
I thought I'd caught the vomiting bug that was going round.
Yes.
Basically, I just couldn't keep anything down. No diarrhea or anything, but it was pretty bad.
Right.
Anyway, it cleared up in a couple of days, and I went back to eating normally. The thing was, though, from that time on, whenever I had a meal, lunch or dinner, I'd feel incredibly sleepy almost before I'd finished, and for about half an hour afterwards. I didn't feel tired as such. I mean, not in the sense of fatigue. It's just that I could hardly keep my eyes open.
I see. Were you in any pain?
No, none at all. The only other symptom was that I was getting very thirsty, especially at night, so I was drinking a lot.
Right.
So I went to see the doctor, expecting some simple explanation, but she said my symptoms were quite unusual. Well, not the drinking. She explained that the stomach upset had left me dehydrated.
Yes, that's right.
But it didn't explain my other main symptom.
And the dehydration passed?
Yeah, that was just a temporary thing. Then she asked me if I'd ever had stomach cancer, which was a bit worrying.
But you haven't?
No. But then she explained that there's a condition that has similar symptoms to those I had. She didn't think I actually had that condition because it generally affects people who've had stomach surgery, and I hadn't. It's called gastric dumping syndrome.
Oh, yes.
Anyway, what she suggested as, well, like an interim measure was following the treatment plan for that syndrome, even though I probably hadn't got it. So I had to keep drinking because I needed to keep my fluid levels up.
Yes.
But not whilst I was eating. So in other words, I had to separate the two activities by about half an hour. Then as for the meals themselves, she suggested an eating regime that she called little and often. So, no major blowouts and no skipping meals either.
Sure. Did that help?
Yeah, it did, but it was only meant to help me in the short term. Because meanwhile, I had various tests. I gave a urine sample, went for a blood test, neither of which showed up anything untoward. So I just hoped it'd clear up of its own accord.
But it didn't.
Well, no. The regime worked all right, but as soon as I went back to eating and drinking normally, the symptoms would come back.
Okay.
So the doctor referred me for an endoscopy. I saw a gastroenterologist for that. He'd looked at my other test results and examined me and everything.
Sure.
And of course, once the results of that came back, they showed that I'd got Helicobacter pylori.
I see.
So I went on the course of treatment, the 3 drugs for 2 weeks,
Yes.
2 different antibiotics and an antacid. That's the combination which gets rid of it.
Yes.
After that, I went back for a breath test, and that was all clear. So I thought that'd be the end of it, and I'd be back to normal.
But you're not.
Well, I've given it a couple of months, but the symptoms are the same.
Okay.
If I stick to the eating regime, I'm okay. When I come off it, I'm back to square one. So I'm thinking, sure, the stomach problem that the gastroenterologist found has been dealt with, but that wasn't what was causing the original problem.
And how's this affecting your everyday life?
I can live with it. Obviously, it would be different if I was driving for a living or operating machinery, but I'm a teacher, so it's okay. But to cut a long story short, I asked for a second opinion, and so here I am.
Okay, perfect. So I believe that was really helpful. That was end of part A. So these kind of videos, if it is helpful. Now, what I'm going to do is I'm going to send you all those. I can see almost around 89 people who are attending this lesson. Please make sure you mark your attendance in the comment section. So write your name in the comment section. I'll send the answer sheet to you personally because I cannot post it public. So what I'll do is just mark your attendance in the comment section, your name. That's all we need. We will send you the sample answer, the answers of this audio, as well as we can even send you the audio. Just mention your name in the comment box so that we know you have attended and it was useful for you, so that we can come up with more videos like this. And please make sure, even in this situation when your exams are cancelled, it's completely fine. Utilize this time to learn more. Please make sure you listen to something every day and try to comprehend it. Because if you're practicing every day, at least for 30 minutes, you're listening to communications, you're listening to audios, you're listening to patient interviews, it can be a TED talk, whatever it is, it's completely fine. Just make sure whatever you're listening at the end of your practice session of listening, not OET audios, any other audios, make sure you write a small summary. So you know that you're able to comprehend what you have heard today. You're also able to understand the main content of that audio. Because every medical audio which you would listen will have one problem and one solution. That will definitely help you. Like if you're able to extract that problem and solution at the end of the video, you're also developing a short-term memory to remember things. Because when you're listening to audio, like most of the time I've seen students write one answer and they feel, oh, I've lost the audio, it has gone way too ahead. The reason is you're not able to store information. You're just focusing on that particular moment. So never do that. So if you want to practice that, please make sure every day at least one audio of 30 minutes. At the end of the audio, write a small summary which will help your listening comprehension ability. Okay, thank you all for joining in. We will come up with such kind of videos, such kind of learning videos. I'll be uploading more writing discussions now so that you really get benefit of our page. Make sure you subscribe this page. Make sure you share it with your friends. And please comment in the section box about your feedbacks. Also your name so that we can send you the sample answer. Thank you so much for joining in. Have a beautiful day ahead. Bye, people.